Hello everyone, myself Dr. Khurshid. I will be teaching some of the important topics regarding the questions which are generally asking in NEET PG and FMG examination. So there are some questions. Today I will start joints. About joints, minimum one or two questions they're asking in general in both exams. So today I will be studying joints. These are some questions. So we'll solve the question later on. Let's first start the topic joints. Joints. In general, joints are three types: fibrous, cartilaginous, and synovial joint. In fibrous joints, again there is sutures, syndesmosis, kyphosis. So in sutures there is skull. Skull, you can see in skull these are the sutures. These are sutures. And in syndesmosis, there is a middle radioulnar joint and middle tibiofibular joint. Middle radioulnar joint and middle tibiofibular joint. This one is radius. This one is radius. This one is ulna. So between these two joints, this one is middle radioulnar joint, and with this one is tibia, fibula. Within this joint it is tibiofibular joint. Okay. So middle radioulnar joint and middle tibiofibular joint, these two joints are syndesmosis and kyphosis. Tooth in alveolar socket. In alveolar tooth, we know that in tooth there is socket and there is alveolar socket. Kyphosis. Cartilaginous joint, there is primary cartilaginous joint and secondary cartilaginous joint. In primary cartilaginous joint, also it's known by synchondrosis, and secondary cartilaginous joint it's symphysis. So in primary cartilaginous joint, this first costosternal joint, sternum, costo means ribs, and sternal joint, and the costo and ribs, costosternal joint, first costosternal joint, and epiphyseal plate between epiphysis and diaphysis. In long bone, in generally epiphysis, metaphysis, and diaphysis. So epiphyseal plate between epiphysis and diaphysis, it is primary cartilaginous joint. And secondary cartilaginous joint, there is pubic symphysis. Pubic symphysis we will be looking here. Pubic symphysis. This one, pubic symphysis. Pubic symphysis. So pubic symphysis, in general it is secondary cartilaginous joint. Question is generally asking like this way that they will show the image, or they will they can be give the question that which type of joint is this. So then you have to write pubic symphysis is secondary cartilaginous joint. Manubrosternal joint. Manubrosternal joint. Manubrosternal joint is between manubra. This one is manubrium. This one is sternum. This one is xiphoid process. So between manubrium and sternum, this joint is called manubrosternal joint. This one is sternum. This one is xiphoid process. So this one is xiphisternum. Okay. So manubrosternal joint and xiphisternal joint. And intervertebral joint, between two vertebrae there is joint, intervertebral. This one is intervertebral joint. This one also cartilaginous joint. The first cartilaginous joint, second cartilaginous joint. First cartilaginous joint, there is epiphyseal plate between epiphysis diaphysis, first costosternal joint. Secondary cartilaginous joint, it is manubrosternal joint. Ziphisternal joint. Then intervertebral joint,